We have with us today Crystal. She's been a patient of mine over the last maybe 2 or 3 years. She's been in several times to see me for particular health conditions, and one of those was nosebleeds. How long were you having those for? How long was that going on for?
For a couple of years, actually.
A couple of years?
Yeah, I could, well, a little bit more than a couple. I could say 5 years.
About 5 years?
Yeah, really intense nosebleed. It would, yeah.
And we put you on some things to build your blood up. In other words, when I did the CRA analysis, and we gave you a couple of things to help the platelets and all that, so your nose would not be bleeding. And how long did it take? Did it take very long before you started noticing a difference with it?
It actually took a week. Actually.
But within a week, you started noticing a difference with it?
Well, yeah, because then that time I had a cold. So what happened is I kept blowing my nose.
Mm-hmm.
And so what happened during that cold, I kept blowing my nose, and all of a sudden I would bleed everywhere.
And that was a common occurrence prior to that?
Yeah.
But within a week of taking the nutritional protocols I recommended, the nosebleed started to subside?
Yeah, definitely. I'd actually start noticing it, that if I had like a nosebleed, it stopped there. That was just a little spot, and it didn't have the whole runny nose thing at all.
And recently, too, we've been treating Crystal for sinusitis, and has that been responding to what I've been doing for you so far?
Yes. That's been working out so far.
Good.
Yeah, the sinus infection, I used to get it every time I had a cold, and now that I have a cold, it doesn't turn yellow at all.
Good.
So I don't have infection at all.
Good. When I work with any given patient, I want to be aware of what their symptoms are. And when Crystal came in to see me, as with any patient, I take a medical history, and also to be aware of any drugs that they're taking, any nutritionals that they're taking, if there's any organs missing, I want to know those things. And also, too, I do an examination. That was all done on our initial consultation several years ago when she saw me. I want people to know, too, as a clinician, I'm looking for the result just as quickly as the patient is. And with a lot of patients, within a week or two, very often, even though they're not completely well, they're well enough to know that what I'm doing to help them is working, is helping them. And we spoke a little bit earlier, too. She's been having trouble a little bit with memory and recall. And I'm going to test her in the regular CRA fashion and see some of the things that we come up with to help her in those regards. And also, too, whatever else the body wants. Keep in mind, on any given visit when I see a patient, the body's prioritizing its needs or what it wants to bring itself back into balance again, or what's called homeostasis. What's interesting is even if a patient didn't divulge why they were here to see me, the body will still show what it wants, because it's dealing with the body from the level of what it wants to be healthy, normal physiology, which is even beyond the symptoms of the patient. So there's several different ways to test a patient, and one of them is something called kinesiology or muscle testing. You'll get a brief kind of glimpse into what I'm doing, and when you come in, if you come in as my patient, there'll be a little more explanation, but I just wanted to kind of give you a demonstration of a contact reflex analysis. So go ahead and stand up for me, and we'll face the camera so people can kind of see how things work here. This is a form of kinesiology called contact reflex analysis. I'm gently holding Crystal's arm, and she's going to lock her arm out. Nice strong arm. And in this work, when I contact a reflex that is not in balance, which represents a particular organ or system in the body, the arm will go weak. So I want to check her heart, and we already tested her jewelry earlier, so we'll go right around her jewelry. This is the reflex for her heart, and we get a nice strong arm. The arm stays strong, so that means that her heart's strong, and we tested her heart before and helped that in certain different ways, and she's strong there. When I get to a reflex that's weak, her arm will drop. So what I'm going to do, this represents the right side of the brain, the emotional, intuitive brain, and her arm's nice and strong on this side. When I get to this side, this represents the cognitive brain, like focus and memory, remembering people's names, things like this. And then she goes, there's a break in resistance. And what that means when I get it is that part of the body wants some help. Okay, so we're going to erase that, and we're going to get a numerical score. This particular reflex, when it's healthy, will score at a 90 score. 10, 20, the arm will drop on the number that it's at. 10, 20, 30, 40, 50, 60. It's dropping on a 60 number. So we're going to erase this reflex, and then I'm going to go to something right here on the arm. This is called the urgent wellness reflex. And we're going to ask the part of her brain that runs the body, the autonomic nervous system, what would it like to have? In other words, where to look to help her. 10, 20, 30, 40, 50, 60 number. 60 number usually is either blood quality, or very often the thyroid can show up. So let's just see what the possibilities are. Give me a real strong arm. So in other words, the body's kind of giving us some hints where to look to help her cognitive brain. So we're going to go to the thyroid, strong arm, and on the positive polarity, this is a test for what a medical doctor would call hypothyroidism. This would be for hyperthyroidism. I'm using the back of my hand, which is called the negative polarity. She's strong there. And now I'm going to check some other reflexes. This is liver. We're asking, is that involved in helping her brain? Gallbladder, bile duct, and the arm goes weak on bile duct. This represents the need for most patients for something called choline. Choline, as far as the brain's concerned, forms one of the main neurotransmitters that runs, I'm going to let her arm rest. Choline becomes one of the main neurotransmitters that allows all the brain cells, for instance, to communicate with each other. It forms something called acetylcholine. So let's just brush down on this reflex. I'm pretending energetically, if we satisfy this reflex over the bile duct for choline, what will happen to the right side of her brain here, strong arm? And now the arm starts to strengthen. That's energetically the body saying, or the body acknowledging that would be beneficial to help her. Okay, so let's move beyond that. So let's see, choline, and I'm using a little mental intention here, so just kind of give me a little license here with this. 100 milligrams, 200, 300, 400, 500, about 600 milligrams of choline a day for about how long? Roughly about 1, 2, 3, 4, 5, about 6 weeks to help her. Knowing that she needs choline too, I want to check her skin, because the skin uses choline to help the oil glands, the sebaceous glands, to make oils. So let's just test a part of her skin. And when I use the front of my hand, the arm's strong. When I use the back of my hand, her arm goes weak. A drop. You feel the drop? How easily it goes? And I'll pretend to give her the choline, and we'll go back and check again. Let's see, the arm starts to strengthen. We're in the winter here, and this time of year here in Virginia Beach, the air is very cool and dry. People have a lot of heat on in their homes, and they dry out. And choline is very beneficial, because this time of year people feel very dried out, particularly their skin gets dry and itchy. Choline is really a very common thing that I find this time of year to help people, as is flax oil, trace minerals, things to lubricate her body. In this particular case, she needs choline. So let's move beyond that. I'm going to pretend that we took care of her brain and we gave her choline. So let's ask what the next need of her body is. I like this reflex because it cuts to the quick. When I use this reflex, we're asking the autonomic nervous system, what's on its mind? What would it like the most to bring the body back into balance? We're asking, is there a secondary need besides the choline?